Hi, this is London Ozone. I'd like to show you how to set up our ozone therapy set. First, connect the power cable to the oxygen concentrator, and switch the button on the back to the on position. Then, turn the oxygen on using the button on the top panel. Let it run for about 5 minutes. This is the so-called warm-up period, which helps stabilize both the purity and pressure of the oxygen. This step ensures a consistent oxygen flow and purity. Next, unpack your silicone tubing. Out of the 2 tubes, choose the one with the small connector labeled O2IN. Connect it to the front panel of the oxygen concentrator. At this stage, you may want to set the oxygen flow rate according to the ozone treatment you'll be doing. The appropriate flow will vary depending on your chosen protocol. Now locate the air filter and the lower connector. Attach the lower connector to the free end of the tube you just connected, and then connect the filter to your ozone generator. It doesn't matter whether you attach the filter or lower connector first, as long as both are properly connected. Next, take your three-way valve and attach it to the top of the ozone generator. Now take the second silicone tube and cut a piece long enough to connect the three-way valve to the ozone destructor outlet on the side of the machine. Add a lower connector to one end of this piece, and attach that end to the three-way valve. The other end connects directly to the barbed destructor port. Make sure the three-way valve points downwards. This way, when you turn on the ozone generator, ozone flows into the destructor first, preventing you from accidentally inhaling it. Now plug in the ozone generator. Choose the correct adapter for your region, UK or EU, and attach the appropriate plug. As you'll see, I struggled a little, but eventually figured it out. Insufflation setup. If you're planning to do insufflations, here's how to connect the insufflation bag. You might want to start with 200 milliliters, so I used a large bag but filled only the first compartment. Connect the bag to the ozone generator, then turn on the generator. At this point, ozone will still flow into the destructor. Check the concentration using the ozone chart. I used a low setting, around 15 to 20 gamma, but for rectal insufflations, you may want to use 40 to 60 gamma. Then, turn the valve on the three-way connector so that the middle arm points to the right. This redirects the ozone flow straight up into the bag. It usually takes 1 to 2 minutes to fill. Once filled, the first thing you should do is clip the silicone tubing on the bag to stop ozone from escaping. I did it the other way around in the video, but ideally clip first, then proceed. Then, 1. Turn the three-way valve back to point downward, towards the destructor. 2. Switch off the ozone generator. 3. Switch off the oxygen concentrator. You can now disconnect the bag and attach the catheter. When you're ready to use it, unclip the tube and gently roll the bag to push ozone in. Filling a syringe. To fill a syringe, use the same setup. Simply screw the syringe onto the three-way valve, open the valve, and let it fill. If the plunger sticks, apply a small amount of ozonated oil for smoother movement. If the syringe is slightly wet inside, it may fill more easily on its own. Once full, detach it quickly and hold it upright. Ozone is heavier than air, so it won't escape easily. Connect the catheter while keeping it upright to avoid losing ozone. Ozonating water. To ozonate water, choose your desired concentration. You can use the three-way valve or connect the tube directly to the ozone generator. Use a lower connector on the other end of the tube and attach it to the top of the glass cup, making sure it connects to the air stone inside. Attach the ozone destructor, inside the machine, to the second port of the cup. This way, any escaping ozone is safely neutralized. Even with the destructor, always ozonate in a well-ventilated space and never inhale ozone. Turn on the generator, check your concentration, and run it for 15 to 20 minutes. The water should be as cold as possible, ideally with ice cubes, and should be distilled. Thank you for watching.